Madhuri Patil, I'm the scientific coordinator of the PCOS Society, and I'm also the organizing chairperson of this conference. When we had the first conference in Mumbai last year in June, all the international faculty from the PCOS Society and all our members of the PCOS Society India requested me to host the second conference, and I think just from the next day I started working on it. My scientific program was ready by August, and then we modified it, Dr. Durusha and myself, we modified it by October, and our final program was ready, and we sent in invitations by then because we wanted to have a proper scientific session so that we have a lot of take-home messages. Initially we had decided that we will have a workshop on lifestyle, which forms the most important part of any PCOS treatment, and we had invited Dr. Rob Norman, who conducts very good master classes on lifestyle, but because he couldn't make it, then we changed our topic to ultrasound in PCOS, and our second workshop was ovulation induction in PCOS, and that is a great challenge basically when we treat our infertility patients, because these patients are very resistant, and therefore we thought we should have this workshop. And what we did was not lectures, so we basically had case-based discussions, so the take-home message to the audience is much better rather than having lectures. In the evening we had our inaugural lectures, which were by our international faculty from the PCOS Society, as well as from our own Dr. Smita Mahale, who's the director of the NIIRH in Mumbai, and we're doing a lot of research on PCOS at NIIRH, which is the National Institute of Reproductive Health, and we partner with them in Abhiyan PCOS along with Dr. Rama Vaidya, which is basically based for disseminating knowledge to the non-medical people, and also collecting data as to what are the phenotypes in India in PCOS, as well as also to know about the different presentations, because it has been seen that the presentations in India as compared to the other world is quite different. Not really have much knowledge as compared to the girls in the cities. Probably I think the statistics is much more in the urban places. That is because of the lifestyle, because today what we see is most of the adolescents especially, they like to eat outside, and what happens is though it is genetic, the PCOS is genetic basically, but its manifestation depends upon your lifestyle. So if you maintain a good lifestyle wherein you maintain your weight, you exercise good, you eat proper, what happens is that your manifestation or symptoms of the PCOS are not manifested, and basically you do not have all the problems. Basically what PCOS is associated is that you have a metabolic syndrome along with polycystic ovaries, and this is basically because of insulin resistance as well as high male hormone levels in the female. So what happens is these women then, because of that, they have a very high tendency to develop diabetes, they have high cholesterol and high triglyceride levels, they have hypertension, and the incidence of cardiovascular disease is also very, very high in this group of patients. And what we have seen is the incidence of cancer of the inner lining of the uterus is also very high in women who have PCOS. We have several patients who, even at the age of 30 to 32, because they have unopposed estrogen action, we've got a high incidence of almost 3% in this young group who have endometrial cancer. Basically, if you look at the statistics, today I think about 40 to 50% of the women who come to us, especially for fertility treatment, have polycystic ovarian syndrome, and we also see that the incidence of gestational diabetes is very, very high. And when we looked at their history, we found that all those women who are developing gestational diabetes, the incidence of PCOS is quite higher. Though even in the non-PCOS we do have gestational diabetes, but probably it is higher in those women who have PCOS. if you look at the incidence all over the country, we can say at least about 30 to 38% of the women are affected with PCOS, and in the today the incidence of adolescent PCOS is also increasing, and I think education is the most important to reduce the manifestations of the disease, because it's basically the obesity, lack of exercise, and what we eat is creating more and more problem. And probably we need to make these girls aware of all these problems, and also the problems what they're going to face later in life, and therefore we should start educating the women when they are young, and probably therefore it's not only the colleges, but I think it is the schools wherein we need to start. And I used to do a lot of these programs, and I found that if they don't have any inhibitions, if there are no men sitting around and boys sitting around, and they really did ask several questions to me, and at least I think 20% of those who have PCOS have benefited by our educational programs. As Dr. Ramavadya was saying, that we've started this Abhiyan PCOS, so we are formulating several educative material for this, and we have identified in the beginning certain schools in Mumbai, and basically, and we are not going to just deal with the only these schools which are government or the municipal. We are also going to look at the higher strata, because we want to know the incidence, whether it is different in people and the girls who are from the lower strata, the middle strata, and the higher strata, because this is, I think, a very, very important thing which we need to find out, and this will probably help us in solving these problems. We are also starting educative programs all over the country, and we are probably asking the ICMR for certain grants for our various projects which we want to continue.
Are you getting any support from the government?
They have still not given, but except from the National Institute of Reproductive Sciences, that is the NIRH, they just help us in certain projects, but there's no financial grant from the government.
My name is Professor Helena Teed. I'm the President of the International AE-PCOS Society, and I'm from Australia, and I'm very privileged to have come to Bengaluru to this meeting of the PCOS Society of India. The AE-PCOS Society is an international society that partners with groups all around the world to promote awareness and improve research and education and health outcomes for women with PCOS. We have a strong focus at present on development of guidelines and on meetings around the world to improve education, and on partnerships so that we can promote the improvement of healthcare for women with PCOS through endocrine, reproductive health, and many other groups, professional groups. The roadmap ahead is mainly focused on, again, improving that education and improving the scientific research and the health outcomes of women with this condition. It was really inspiring to see the 750 people who came for this meeting of the PCOS Society of India in partnership with the AE-PCOS Society, and to see the calibre and significant contributions of the people here. Given the population of India and the prevalence of PCOS for this community and the significant impact it has for so many women, it's inspiring to see such fantastic progress from the PCOS Society of India, and we look forward to a future successful partnership.
Rico Carmina. I am the Director and CEO Androgen Accept PCOS Society. My office is in North Hollywood in California, United States, but I'm Italian, and I travel all around the world just to promote the mission that is a mission of improving research and clinical treatment of women with PCOS. This is an important problem that affects almost 10% of all women in the world. So it's very, very common disease. It's considered the most common endocrine disease. And it affects the life of young women, and it's very important to help these women to have a better quality of life, to believe more in themselves, to believe that there is a possibility to be normal women with a normal life like all the other women. So I'm very happy to be here. In India. India has a big population. It means that I don't know many women with the PCOS may be in India, but you may calculate that's 5% of all population, or many may be 50 millions, so probably more. So it's a big problem, and we hope to do something to improve it and to help all these women.
Hi, I'm Dr. Durusha. I'm a gynecologist and I'm currently the president of the PCOS Society of India. This organization was initiated about 2 years ago because we feel that PCOS is a condition which is so very common in our country. It starts usually in about it's supposed to be present in approximately 1 out of almost 6 girls, 1 out of 5 to 6 girls, and this usually initiates at the time of puberty. Once they reach puberty means the girl becomes into a young woman. That's when all her problems start. She may present to us with probably irregular periods, or she may have cosmetic issues in terms of facial hair, she may have acne, she may develop a lot of obesity, she may also have a situation of pigmentation which she's very, it causes a lot of stress in young girls. If they have a lot of acne and facial hair, they may lose hair on the scalp, etc. So these are the cosmetic issues they deal with, and they end up with various kind of cosmetic therapies, but they're not really addressing the internal problem they're having. The concern we have today as doctors is that these are the young girls who are in future likely to face problems in terms of fertility issues, irregular periods, heavy bleeding, then excessive obesity, and this finally leads to problems with pregnancy issues in terms of multiple miscarriages. They could also have problems with gestational diabetes developing, means diabetes during pregnancy, and these are the young girls who later on will become diabetic after the age of 40. So diabetes being so very common in our country, we feel this is the area where we can prevent the problem, and because we can treat them, not really treat them because we still don't have a cure for PCOS, but we can control the problem in terms of advising them on their lifestyle changes, advising them about this therapy, advising them about all the issues which are related to this. So besides diabetes, these young girls can get high blood pressure as they grow older, they can get cancer of the uterus, they can have metabolic syndromes which leads to a heart attack at an early age, between the age of 50 and 60. So the idea this year really for us is we have started with educating doctors, but this year our focus is going to be on educating young girls and talking to them about this problem, because their only source of information happens to be their own friends and relatives, etc., who talk to them about it, or they Google it, and I don't know which kind of site they Google because they get a lot of incorrect information. So the idea is to get the correct information out there and telling them what are the precautions they need to take at this stage of their lives so that they can have a healthier future later. So this is our agenda, and as a matter of fact we are initiating a website very soon which is going to be launched very soon, and that is a website which will reach out to young people, and we would have blogs on that. We would answer their questions, talk to them about their problems, and gradually we will get this pushed out more and more. So this is the agenda. We will carry out live interactive awareness program with young girls in colleges and schools, wherever we can find them, and that is where we want to bring on this awareness. I think this is our objective at the moment, and we have got together as a multidisciplinary team which consists of gynecologists, dermatologists, endocrinologists, nutritionist, physiotherapist, all the people who deal with and who take care of these patients, and therefore this group becomes a very, very unique group focusing on this area, and we do hope in future to do a lot of research on this subject, and hope that we can come up with something in the near future.